So at the outset, I would like to thank all the organizers of this DAYDEIC conference for giving me this opportunity. So today I'll be speaking on the topic foot care and footwear in diabetes. So everyone wants to have a beautiful feet like this, but in diabetic patient, it's not so because diabetic wounds are common, costly, complicated, and every wound is different. So according to statistics, if we see, so every 30 seconds, someone somewhere in the world loses their limb due to diabetes, and 70% of all these amputations are caused by diabetic foot ulcers. So more than half of these ulcers, they get infected over a period of time, and 70% of these amputed patients, they die within 5 years. So as we know, there are different causes, but the most common it is peripheral neuropathy, peripheral arterial disease, and post-traumatic ulcers. But there is one entity known as plantar pressure, which it is the most neglected thing, and most of the clinicians don't know about this. So very much knowledge is required in this field. So I'll be talking about this, and I'll be sharing my insight into the footwear and foot care on this topic today. So Bolton said it is not what you put on the ulcer in diabetic foot that heals it, but rather what you take off the wound. It means that you have to take out the pressure which is causing the ulcer there. So as discussed since morning, diabetic foot is a multimodality management. So there are many modalities involved like biomechanical, vascular, wound treatment, infection, educational, metabolic control, and as Anuradha madam just now spoke about, even the psychological well-being has to be taken care. So today my topic like foot care and footwear. So these are the five important pieces for diabetic limb salvage. So podiatric care, that is foot care, has to be the most cornerstone of every diabetic patient because if proper foot care is not done, they'll end up in lot of problems. Right from starting from a small blister, they end up in gangrene and later they undergo amputation. So protective footwear, which I'll be talking in an elaborative way, pressure reduction, prophylactic surgeries, and preventive education. So these are the five P's of diabetic limb salvage. So as we know in India, we have a lot of social challenges in offloading and foot care. So we have lot of crowded transport systems, unhygienic living conditions, and India being a religious country, we have lot of religious visits by our diabetic patients. They walk usually barefoot. They are not used to wearing this footwear, and they don't even take care at least using a protective covering like temple socks which are available these days. They don't even wear that and they just go on a pilgrimage, and later I have patients who come with blisters and later land up in gangrene and amputation. So when we talk about footwear, we go to history. So it is estimated that the history of footwear started somewhere around 5 million years ago, and it is attributed to the unkind weather conditions, and they started feeling that okay, there is a need of footwear. So before what we wear, or we should be knowing what not to wear actually. So the first picture you can see, so this is the incorrect way of wearing a footwear. We see these days lot of fashionable footwears coming up in the market, and even the shoes which the male patients wear. One second. So this is the one like you can see here there is a narrow toe box. The toes are getting crowded as well as the metatarsal in the lateral aspect is also getting hurt here. So this is the stylish kind of footwear. It looks really good, but it is the major culprit for causing ulcers here. As you can see in the this picture, there is a shallow toe box, and usually our diabetic patients, they have neuropathy. Over a period of time, they develop hammered toes. So this is getting friction on the dorsum of the toe. So this is the red area, like what to say, it is the impending area for an ulcer. So this is the right method of using a footwear. It should have a extra depth. There should be some space in between the toes and the footwear, and it should have a white toe box here. So this is how ideal footwear should be. And we have seen our female patients wearing this kind of footwears where they have a thongs or a toe strapping, which has going to cause a web toe infection. So this is a hard sole and it has a toe separator here. See, most of them, I see patients wearing this kind of footwear. Whenever asked, they tell we are comfortable with this. But this is the most worst footwear they can ever wear. So we always recommend a soft MCR sandals with inbuilt arch support. So always a footwear in diabetes, it depends on the activity level and what kind of deformities they have. At least if they are not fond of wearing anything in the initial stages, at least they can wear sport shoes, and later, as and when the customization is required, we can get it customized and get the footwear done. So what is the principle of footwear in diabetes? So it helps to accommodate the deformity. It helps in distributing the pressure. So what happens in a normal person, it is different. The plantar pressure is different, whereas in diabetic patients, it is more than 500 kilopascal. So every step they take, that much of pressure gets multiplied. And this footwear helps in reducing the plantar pressure by 70%, and rest of the 30% is taken care by the socks what they wear. So usually this footwear, it helps to prevent excessive shear force, and also helps to prevent excessive movement in the footwear, because we give a proper arch support, we give a proper heel counter, and there is an extra depth. So the moment, what happens, because the patients having neuropathy, they don't even get to know what they are doing actually. So the slippers used to slip off from their foot, and they get hurt, and they get all these injuries and ulcers. So when you give a proper kind of footwear, so this prevents all these problems, and it helps in achieving optimal neutral walking pattern. So what are the characteristics of an ideal footwear? So it should have a wide toe box, as I said, in extra depth. Appropriate insole should be given. See, a normal patient, MCR insole, okay, fine. But if they have any deformities, which I'll be showing in the coming slides, so a proper customization has to be done. So if a patient has a callus, some modification has to be done for that particular area. And even heel counter should be proper. A rigid outsole should be there. Why? Because something they stamp, they should not be getting hurt inside their insole. So outsole should be very rigid, and it should not allow any foreign bodies to enter inside. And a rocker adjustment should be given, which I'll be talking next in the coming slides. So as I said, the plantar pressure 70% is taken out by a proper footwear. Now the 30% reduction is done by your good quality of socks. Usually, again in socks we have different varieties. So we recommend a proper cotton kind of socks, and it should have breathable material, and it should be easy to wear. And wherever pressure reduction is required, in such conditions we give a silicone lining inside that. And also temple socks, as I said, it has a outsole. Actually, a thin layer of outsole will be there, where these patients, if they are going into a religious places or even inside the house, they can wear this kind of temple socks. So these are the different varieties of footwear which we prescribe in diabetic patients according to their necessities. So why footwear is very important? Because diabetic foot is having a complex mechanism. As they have neuropathy, they can't sense pain, and most of the patients, they have limited joint mobility in the grade 2 and other joints. So, and also they have abnormal shape of foot, and they have various deformities. As I said, they'll be having hammered toes, they'll be having hallux valgus. So depending upon the deformities, you have to customize their footwear. And most of them, as I said, they get amputated because of the gangrenous or other toes. So even post-op, their stumps have to be seen, and according to that, footwear has to be prescribed. So, and whenever you see a callus, so it is a danger sign. So it tells that, okay, I'm going to start an ulcer now. So always, whenever you have callus, never think again. So immediately try to prescribe a footwear by proper customization. Like that, you are helping your patient by not developing further complications. And most of the times, they'll have crowding of toes, or they have separation of toes and metatarsals on the weight bearing areas. So these kind of deformities have to be taken care by a proper customized footwear. So why footwears are important? They are very crucial because they they are more important in patients of neuropathy, and they help to reduce the shock, that is vertical pressure and the shear force, as I said, and they limit the movement of certain joints, which help in decreasing the inflammation, they relieve pain, and result in the more stable and functional foot. So I was talking about pressure all this time. So what you're going to do for this pressure is you have to offload. Always, if you offload, the plantar pressure decreases, and it helps prevent further ulcers, and also it heals the plantar ulcers whatever is there. So basically offloading means you have to take out the pressure over there. So there are different modalities where you can study the pressure, which I'll be telling next. So how this offloading footwear work is, they provide room for accommodating deformities, they provide adequate depth, and they reduce the loads at critical areas. They help in proper gait of the patient, they are able to walk, because I'll be showing in the next video where how the gait changes because of a proper footwear. And better advice for healed ones, healed feet, or the ulcer is already healed, not for a patient having any ulcer, because doesn't help in healing of the ulcer. Basically, it helps to just take out the plantar pressure. But once the ulcer heals, you have to prescribe a proper customized footwear for that patient. So this is one of my juvenile diabetic patient. Sorry, my video is not playing. Okay. So look at the gait of this kid, how he's walking. He's a juvenile diabetic, and you can see there. So we give him a customized footwear. Now you just look at the gait. It is almost changed. He's able to walk properly. So this is how the difference is made in somebody's life. Your footwear can do wonders. So how do you decide where to offload or what kind of footwear should be given? So there are innumerable number of methods. Commonly used are this foam box and Harris Beth mat and foot scans. So this is how you take the impression on a Harris Beth mat, and you can see here there are pressure areas where it is showing dark areas here. So these are the ones which have to be taken care when you prepare a footwear. So at least if you don't have anything, you can take the impression on a carbon paper and you can see the pressure areas. Another simple method, if you don't have anything, you can prepare a thali, which in which you can use this sindoor wala water, and you can tell the patient to put the feet on that, and you can tell the patient to give the impression on paper. When you don't have anything, at least you can do that. So these days, everything is advanced. So we have in-shoe sensors where this can be put inside the footwear, and it will be connected to a mobile app, and that gives you a pressure study of the patient's foot. So this is the foot scan what I was talking about. So the patient is made to walk on the scanner and it records the pressure. So these red areas, these are higher plantar pressure areas. So as it goes towards the blue, so those are the lesser pressure areas. You can see here in the metatarsal region and in the heel area, the lot of pressure is there. So it is indicated by red color. So what are the characteristics of an ideal insole? So it has to be at least minimum of 8 to 10 mm thickness should be there. The shore hardness, which is measured by a durometer, it should show between 25 to 35 and must distribute pressure equally over the forefoot, and it should reduce the stress wherever it is intended to do so, and should not bottom out quickly, and should protect the high pressure areas. So these are the different materials which are used in diabetic foot insoles, starting from plastisode, poron, EVA insole, and microcellular rubber. So we commonly use this MCR chappals, and even we can use EVA insoles. These also can be used. EVA insoles are a little bit costlier, but they give good pressure relief. So for pressure relief, we can even make holes like this, but this is a temporary relief, because what happens over a period of time, at least after 15 to 20 days, as the patient starts working on this, the margin bottoms out, and again you need to redo it. So at least for the, it's just a temporary method where it is helping ulcer healing or something like that. So coming to customized insoles, these are made by molding high quality foam under or using a foot impression box and or also a plastic cast. So these are effective in providing support, and they help to reduce your shear pressure and other areas of ulcer breakdown. So this is how we take a foot impression on a foam box. This is very soft material actually, but this gives at least a proper idea like where it has to be offloaded. You can see here, there is loss of arch here in this patient. So like this, you get to know what kind of modifications you need to do. And this is very cheaper and effective method. If you can't afford a foot scan, at least you can use this foam box. So patients who come with heel ulcers, so this, as I said, this is not a lifelong modality. So if they have ulcers, you can use these kind of footwear, and till the ulcer heals, you can be using this, but it has to be used only on a one part of your foot, not the other, because they lose balance. So whichever is affected, you have to use there. So they give uh, stability to the ankle, And they actually, along with this, you have to tell the patient to use a walker or a walking stick, because they might slip and fall. So coming to midfoot ulcers, as you can see, this is known as a rocker shoe or a rocker sandal. So what happens is, usually you have in walking, you have this heel strike, mid stance, and toe off. So this heel strike and the toe off phase is taken care, whereas only mid stance, the patient can put his foot. So these two things are taken off and the pressure is offloaded. So as you can see here, there is an ulcer here. So this has to be offloaded. This area is offloaded. So this is taken care. Forefoot ulcers, again, there is a front wedge sandals. Again, you have to use along with walker or a walking stick. So this is used where our ulcers are there in the forefoot areas, like in the toes or in the metatarsal regions. So this can be used and till the ulcer heals, and later you can customize the footwear and tell the patient to use proper customized footwear. So as I said, there is a callus or a con. So these are temporary relief methods where you can excavate a hole in the insole and it can be put inside the footwear. So once the ulcer or the corn area heals, later you can remove this insole and you can put a proper customized insole. So we see many patients with toe amputation. And what happens once the toe is amputated, as you can see in this picture here, once the toe is amputated, the remaining toes, these ulcer areas will be there, or if even the stump is healed, what happens is all the pressure is going to put on this greater toe here. So this needs some sort of supporting here. So what we do is we give a filler sort of insole here, so that protects the surrounding area here, and it helps in giving pressure reduction. You can see here there's a great toe here, there is absence of toes here, but this filler, whatever the way, it is forming a footbed and it is protecting this stump area. So again, in case of partial foot amputation, what happens? Once the all the toe goes, here you have some problem with your tendo Achilles, or you get the tightening of the ankle joint. So there is limited joint again in the ankle joint. So for this kind of things, what has to be done is the ankle has to be stabilized when they walk. So this is the footbed sandals. It has customized insole with filler and carbon fiber plate will be there. So this stabilizes the ankle whenever the patients walk, and he won't have much problems, and even he doesn't develop ulcers over the amputated stump. So again, in unstable ankle with partial foot amputation, so you can give a customized ankle foot arthrosis, also known as AFO. So you can use either soft plastozote or a evazote lining. So this is a special kind of special kind of ankle foot arthrosis. This is actually lightweight. So where this has a supportive system, so that this ankle is stabilized for this kind of patients. So as I said, rocker sole, it basically takes care of this heel strike and toe off position, and it helps in forward propulsion. So it helps in offloading areas of high plantar pressure, and it helps to restore the lost motion and injury or deformity. So these are some modifications which can be given under the footwear, where like these are also known as silicone toe splints or something. What they do is they actually see this bunion is there here, so that is going to get friction with the footwear, and it is going to form an ulcer here. So these toe splints, what they do, they actually, they once you pull it and put, so it becomes little straightened, and this prevents the this bunion area from getting ulcerated. So and also gives good pain relief, and also it can also be worn at the night. So again, as I said, hammer toe, mallet toe, these are different deformities there. So usually we do surgical corrections. I do a lot of surgical correction of these hammer toes and other toes. But once you feel there is patient is reluctant, or too much of age-old patient, or patient is not willing to get the surgery done, or if too much of fusion is there, a rigid toe has already happened. So in these cases, you can use a silicone toe splints, and you can they can wear it under the footwear. And also we get something known as toe separators. So we have seen a lot of patients coming with fungal infection of the web spaces. So in that conditions, you can use these toe separators. They actually work wonders. So they prevent further fungal infection spreading towards the other toes and other things, because the toe gets separated. In diabetics, usually after some years, what happens, they get deformed, and they have these crowded areas. So these crowded toes, they lead to fungal infection, because moisture is getting collected in between the toes. They come out with fungal infection. So best way is you can use silicone toe separators and get rid of that fungal infection. So we have, as I said, there are overlapping toes like this. Again, you can use some toe straps, and that help in accommodating the deformity inside the footwear what they are wearing. So all of you are aware of this red feet, swollen feet. So it's always not cellulitis. Please take this into consideration. It might be a Charcot's foot. So even Charcot's foot, it presents with swollen red, and it is hot on examination. Many times, even I have seen surgeons getting misdiagnosed as cellulitis, and they treat as cellulitis. And later we see that already the patient has gone for a higher levels of classification of Charcot's foot, like it has gone up to ankle joint level, where you can't even stabilize it. That kind of foots come to us. So always, whenever in the initial stages when you diagnose, please get one simple is you palpate with your dorsum of hand. You'll feel the temperature is more compared to the opposite foot. If you are in doubt, get a arterial Doppler done, and later your X-ray confirms that there is Charcot's foot, because in cellulitis you don't see that Charcot's foot changes, but in case of Charcot's foot, your X-ray changes will let you know, because you have increased osteoclastic activity in that particular area. You can diagnose as Charcot's foot. So these are pneumatic walker diabetic systems where the patient's foot is suspended in air. They don't even feel that there is some stress on the foot actually. So there'll be some air pumping system inside the footwear here. So they feel that their foot is in the air. So this helps preventing ulcers. So coming to customized ankle foot orthosis, as I said, this Charcot's foot, they have a lot of instability and a lot of deformities will be there. So they need proper offloading. You can use inner soft plastozote or evazote lining to prevent any further deformities. And if you feel, see in this picture, you can see a lot of deformities there in the ankle, in lateral malleolus, and patient is trying to invert the foot. So in such conditions, you can give ankle foot orthosis with a proper stability of that foot. So you can also use removable cast walkers. So they are cost effective, and the added advantages here, the wound can be inspected without any further problems, and pressure reduction is very excellent, and can be difficult for patients with ambulation problems, but along with support they can be accommodated in this kind of footwear. Only problem is that it is a longer shoe, and they have some problem in wearing that, but once they get used to it, till the ulcer heals, you can use these kind of footwears. So coming to crow shoes, so this is very nice method of offloading any ulcer, or giving a proper stability, because what happens, it is just a modification wherein upper flap is there and a lower flap. You can just put it and you can strap it off. So it locks the ankle and it reduces the pressure areas. And again, in this, you can add any kind of customized insoles, and you can offload the pressure areas. So once Dr. Paul Brown said that diabetic patients had congratulated me on shoes that I had prescribed for more than the surgery which I had performed. So your footwear, what you customize and give, that is more important to a patient rather you doing heroic surgeries on the foot. So we see many patients getting self-surgery done using these blades and other cutters and other things. It is really dangerous, because they have neuropathy. They are not aware till what level they are going. And many times I've received patients coming with bleeding, continuous bleeding. So tell them to avoid self-surgeries and always see a foot surgeon as early as possible. And diabetic patients should avoid pedicure, because what happens in this parlors, they remove this cuticle, which is the protective layer, and later they have this lateral margin toe infections, also known as paronychia, and later they develop gangrene and other things. Heat and ice fermentation a must know to any diabetic patients, because even with ice, I've seen patients coming with blisters, epidermal damage, and later they're developing foot infections. So footwear with tongs, strict no, 100% should not tell them not to wear these kind of footwears. Always use proper customized footwears or at least diabetic sandals. And all this acupuncture footwear and other mats are very much available in the market. They advertise a lot, but these are not for our diabetic patients. They cause lot of pressure ulcers, and sometimes even they come with small just a penetrating injury, and later they come with ulcer discharge. So always worn out sandals should be checked, and should you should always advise the patient not to wear this, because what happens, maximum life of a footwear is just 6 months, or maximum max, if they are not affordable, at least 9 months it has to be changed. Again, what happens, the insole gets worn out and the patient is wearing the same kind of footwear, there will be a lot of friction between the insole and the foot, and they develop ulcers. So especially ladies, they are fond of wearing stylish footwear like this. Heels, these are a strict no. If at all, if they want to wear just 10 or 15 minutes, I actually, they come and ask me, Madam, we have a function, can we wear? I just tell them to carry one more pair of footwear. So if you are standing in for a long time, again you have to change into your diabetic sandals. If you're going on the stage, just wear this and come off, but don't be on the sandals for a longer time, I tell them. So toe rings and threads, again, these are a major cause. What happens is they actually uh, hamper the blood supply, and unknowingly, because patients have neuropathy, they don't even notice what has happened. Finally they come to you with some blackening of the toes or with ulcer discharge. So later you see this is the main culprit there. So usually I tell diabetic patient not to wear the toe rings and threads. Only in cases of their some cultural festivals or something, they can wear it for some time and they have to remove it. Because what happens, they'll be having some side some modifications. They won't prick that particular areas, they don't even get to know. They only come to you when they have ulcers and discharge from that wound. So strict as for these things. So always avoid bites from mosquitoes, rats and other things, and do a foot self examination using a mirror. Also you can take a foot selfie and send it to your clinician, and take good foot care by using moisturizer. All since morning you've been having brainstorming session about the sugar monitoring, diet and other things, so that has to be taken care of. As I said, customized footwear to be worn and foot care to be done. Always never hesitate, tell your patients not to hesitate to consult your consultant by in person, or they can do a phone call, or nowadays WhatsApp is they can at least put your message, and they can also do a video consultation. So in our clinic, we have displayed this. It is in Kannada, basically our language. So we have given this foot care tips, and we also have a WhatsApp group for our patients. I have kept it as food saviors. I added almost all my patients into this group. So whenever they have problems, they actually contact me, or they put their problems in this group. And also I keep posting some important messages and preventive measures on this group. So that's how we are taking care of our patient's feet. So always prevention is better than later treating the ulcer. So these are the 10 commandments of foot care that is given by Diabetic Foot Society of India. So that is, do not walk barefoot, always have a some kind of footwear at least. Even these days, I make it sure that my patients, they walk with footwears even indoors. I am very strict in such matters, because they should not develop even a small ulcer when they come to me. So whenever they come for follow up, so every 3 months we call them for follow up. So I always ask them repeatedly, so are you wearing footwear even inside the house? So they should inspect the feet daily for blisters, wounds, bleeding, and warmth, and they should not apply any over-the-counter drugs or any ointments which are available in the market without your consultation. They should not apply hot fermentation or cold packs. They should use correct kind of footwear or customized footwear, and they should not walk bearing weight on the affected foot. As I said, plantar pressure is very much detrimental to their foot health. They should not be sitting cross-legged for a long time. They should never remove footwear during or something, because the heat causes the blisters there. And they should cut their nails regularly, trimmed squares, and they should not do any self-surgeries, and they should clean their feet and always keep their web spaces dry. So all that you need is a pair of sensible hands and eyes. So I would conclude telling that patient of plantar ulcer is not supposed to walk unprotected. Customized footwear is very important. It works as icing on a cake for better healing. And usually patients wear comfortable footwears rather than scientific footwears. So early detection and protection of high pressure areas and foot care is the only strategy to prevent limb loss in diabetes. So we should need to revive the age-old culture of foot care and footwear. So I would like to conclude my talk by this famous saying by Ambrose Bierce, I dressed him and God healed him. So the foods are crying, save me please. Thank you. Thank you so much for this opportunity.